Hi everyone, my name is Salvador Rico, Chief Medical Officer at Encoded Therapeutics. This month, the journal Epilepsy Behavior published a systematic literature review of the burden of Dravet syndrome. The clinical and medical teams at Encoded Therapeutics, which I am honored to lead, alongside with preeminent Dravet syndrome clinicians and key opinion leaders, Professor Samir Zubairi and Dr. Joe Sullivan, co-authored this paper. This is part of Encoded's multi-pronged strategy to improve our understanding of the disease ahead of the initiation of our first-time human clinical trial with ETX-101, an investigational gene regulation therapy. This literature review summarizes the contemporary available data to help paint a fuller picture of the disease's impact on individuals, their families, and the healthcare systems. One of the outputs of this work is an evidence-based contemporary visualization charting the evolution by age of the seizure-related manifestations, as well as all-cause mortality and mortality due to sudden unexpected death in epilepsy, or SUDEP. A second figure illustrates the evolution of the non-seizure-related manifestations, such as the neurodevelopmental stagnation, the impairment of speech and communication, and the behavioral and motor problems. The review confirmed many of the known yet sobering aspects of the disease, such as extremely high and early incidence of seizures and the early incidence of communication and motor problems in many cases by age 2 years. We also found that, while likely underreported, the direct costs of treating patients with Dravet syndrome are very high, and that both patients and caregivers have an impaired quality of life. Mothers, in particular, seem impacted both personally and professionally. These SLR reinforce that gaps remain in our full understanding of the disease, greatly in part because many of the studies conducted to date have been cross-sectional and they lack the longitudinal follow-up for us to understand the impact and progression of the disease over time. Along with the Dravet syndrome community, Encoded is working to fill those gaps. On the one hand, we have our Dravet Engage initiative that is focused on understanding the direct feedback and perspectives of the patient community. We also have our Envision Natural History study that is focused on understanding the trajectory of the symptoms in the youngest patients living with the disease. All of these efforts remind us that Dravet syndrome affects the entire family unit, and that it is essential that we identify clinical trial endpoints that are meaningful to the whole family and not just to the individual. As Lauren, mom to Finn, who's a 7-year-old patient living with Dravet syndrome, reminded us once, Dravet syndrome is a whole family syndrome. This work would not have been possible if it were not for families like Finn's, who share their stories and give the gift of data in many different ways, either through participation in surveys, natural history studies, clinical trials, or by consenting to have their medical records shared for retrospective studies. It is his family's strength, courage, and commitment that drives our mission. We're looking forward to continue to work with the Dravet syndrome community on similar efforts.